The SurgiVet Advisor Vital Signs Monitor is designed to be used on veterinary patients by trained veterinary professionals. The Advisor Vital Signs Monitor is intuitive and easy to use. It utilizes a rotary knob to help the user navigate the on-screen menu options. When the cursor is moved over an item, it will highlight that item in white. To select the highlighted item, push in the rotary knob. This action will either bring up a submenu on the lower left of the screen or allow you to select different modes within the highlighted box. To exit a menu, simply rotate the knob to select Main. This will return you to the main screen. Selecting Previous takes you back to the previously viewed screen. The top left of the monitor screen displays the date and time. To change the date or time, use the rotary knob to highlight the date-time area and push the rotary knob in to select it. A submenu will appear on the bottom of the screen. Scroll through the numbers and press in the rotary knob to select the correct values. The date and time will roll over automatically. The next column over displays patient type. This setting changes the alarm parameters and NIBP inflation pressure that is most appropriate for the species selected. For example, cats, small animals, and dogs less than 10 pounds would fall under the cat heading. Dogs and medium-sized animals would fall under dog, and horses and large animals would fall under horse. The monitor allows patient monitoring with adjustable alarm limits, as well as visible and audible alarm signals. The cursor will jump over the Alarm Mode area on the top of the screen, as it is for alarm information only and cannot be manipulated. On the far right of the monitor display is the Patient Information and Parameter Data area. Selecting this area will bring up a menu on the bottom of the screen. Choose which information you would like displayed on the screen, such as bed name, patient ID, or patient name. Use the rotary knob to scroll through the alphabet and select the appropriate characters. When finished, select Main Menu to return to the main screen. Entering new patient data will remove all previous patient data from the memory. The parameter boxes are listed down the right-hand side of the display. Each parameter box displays the parameter name, high and low alarm limits, which vital sign is being measured, the units of measure for that parameter, and any error messages which will be displayed as they occur. The first parameter box is for the ECG, heart rate alarm waveforms, including primary lead settings and waveform size and speed, can be manipulated by selecting this parameter box. This parameter box is also where the heart rate source can be chosen from. The default heart rate source is the SpO2, but it can be changed to ECG, ART, or Auto. Auto will pull the heart rate from the most stable source. ECG printing options and turning the module on or off are also located in this area. The second parameter box is for the N-Tidal CO2 module. Selecting this parameter box allows alarm settings for N-Tidal CO2, inspired CO2, and respiratory rate to be changed, and the waveform scale and speed to be altered. Here, the module can be turned on or off. Calibration can be initiated, or the parameter values can be printed. For units purchased with the invasive blood pressure option, the IBP parameter box is the third box down. Selecting this parameter box allows the site label to be changed. This will change the scale, alarms, and parameters monitored. For example, naming the site ART will set the monitor up to read systolic, diastolic, and mean arterial blood pressure with an appropriate scale. Alarms can be manipulated, and the waveform can be accessed and changed as well. The waveform is named after the site label, and selecting this area allows the scale and speed to be changed. Waveforms can be separate or overlaid, heart rate displayed, and the pressure can be zeroed. Printing a strip or snapshot of this parameter can also be done here. The SpO2 parameter box displays information from the pulse oximeter. Highlighting and selecting this parameter box allows the SpO2 alarms to be turned on or off, the sweep speed to be changed, and the peripheral pulse rate, or PPR display, to be turned on or off. An averaging period can also be chosen. The averaging period is the measured values for SpO2 and PPR that can be determined by averaging the sensor readings over a selected number of beats or seconds. If you choose slow, the measured value displayed for the SpO2 will be the average of the oxygen saturation readings over 16 pulse beats. The measured value displayed for peripheral pulse rate, PPR, will be the average of the number of pulse beats over 16 seconds. Parameter strips and snapshots can also be printed from this area. The non-invasive blood pressure parameter box can be highlighted and selected to change alarm settings, blood pressure reading interval, inflation pressure, completion tone volume, and to view the NIBP history. For units purchased with the temperature option, the temp parameter is the last box on the display. Highlighting and selecting this allows the temperature alarms to be changed as well as the units displayed from Fahrenheit to Celsius. The temperature channels can also be turned on or off in this menu. Along the bottom of the main menu screen are more options that can be highlighted and selected. Alarms are displayed when the Alarms menu is selected. Limits can be changed and alarm volume can be adjusted here. The Printer menu allows for the auto print alarms to be turned on or off, print speed to be adjusted, or a screen snapshot to be printed. Trend data can be viewed in the Trends menu and navigated by either vital sign or date and time for a 24-hour period. This area is where the interval recording time can be set. Reports can be generated by selecting a specific procedure start and end point. NIBP history can also be viewed or printed here. The Setup menu allows parameter changes, including the waveforms to be printed, the parameters to be displayed, the units for each parameter, and pulse volume adjustments. Bed name, parameter colors, software revisions, and the Service menu are also located in the Setup menu. The Quick Set menu allows for temporary override of the alarm limits for the patient. All alarm limits, or only those that have been exceeded, may be altered by entering the Quick Set menu. The Suspend mode temporarily stops monitoring. In this mode, no data is stored and no alarms are issued. Suspend mode is recommended for use in between cases when applicable, instead of powering down the monitor. The NIBP menu allows you to switch between NIBP modes. When in the default manual mode, a reading is initiated each time the NIBP button is pressed. Auto automatically takes a reading at a preset interval, and Stat reads continuously for 5 minutes. The Freeze button temporarily freezes all current displayed waveforms, so you can analyze them on the screen or print them out. The parameters can also be accessed by selecting the waveform box on the left-hand side of the monitor display. Here, you can select which waveform is to be displayed or cascade the ECG waveform. Tips and troubleshooting. CO2 module occlusion. If occlusion in the CO2 sampling occurs, an occlusion message is displayed on the CO2 parameter display. There are 4 accessories to inspect when this occurs. The first accessory is the patient's sample line, which should be removed from the water trap. If the occlusion message disappears, replace the patient sample line. The second accessory is the water trap, located on the right side of the CO2 module when facing the back of the monitor. When the water trap is removed, you will need to inspect the 2 silicone collars located on the top of the trap and ensure they are not crooked or damaged. The third accessory is the CO2 canister, located on the left side of the CO2 module when facing the back of the monitor. Ensure that the granules are not desiccated or more than 2/3 purple, and that the canister is properly inserted into the module. The fourth accessory is the 9048 disc filter. It is located to the lower right of the CO2 canister. It is connected to the clear sample tubing by a male lure connection, which is connected to the CO2 module. Gently remove the disc filter from the module and unscrew the disc filter from the male lure on the clear sample tubing. Once all 3 accessories have been removed from the CO2 module, you will inspect the CO2 parameter box on the Advisor monitor display to review if the occlusion message has disappeared. If the occlusion message has not disappeared once all 3 accessories have been removed, this indicates that your CO2 module will need to be serviced by our authorized service center. Please contact Smith's Medical at 800-258-5361 to arrange for service. If the message has disappeared, you will need to replace the accessory items systematically to isolate the items causing the occlusion. You will reconnect the 9048 disc filter onto the male lure of the clear sample tubing, then reconnect the filter to the module port. Wait 10 to 15 seconds to ensure the occlusion message does not reappear. If it does appear, you will need to replace the 9048 filter. Calibrating the capnography module. The capnography module must be calibrated to ensure the measurements are accurate. Calibrate the capnography module once a month or every 100 hours of use. Connect a new sample line to the tubing on the regulator. The sample line should already be connected to the water trap. Turn the rotary knob on the monitor to move the cursor. Highlight the CO2 parameter box and push the knob to select it. Highlight High-Low Cal and push the knob to select. Turn the rotary knob to highlight Yes and push the knob to select it. The monitor will first perform a low calibration. After a short time, the message Turn Gas On will be displayed in the CO2 parameter box. Quickly open the flow control valve on the calibration gas canister. The valve must be fully opened in less than 30 seconds. When Turn Gas Off is displayed in the CO2 parameter box, close the flow control valve of the calibration gas canister. When the calibration procedure is finished, Cal Done will be displayed in the CO2 parameter box. Inserting printer paper. Use only replacement printer paper that is specified for this device. Using any other printer paper may produce undesirable results or may damage the printer. Open the printer door on the right side of the printer. Gently pull the door down until it's completely open. Insert the paper roll into the paper carrier. The paper should come out from the bottom of the roll and snap into place. Unroll about 10 centimeters or 4 inches of paper, then push the paper carrier door up until it locks into the printer housing. The printer is now ready to print. Note, if no print appears on the paper after changing, the paper may be installed in the wrong direction. The printer will only print on one side of the printer paper. Make sure the paper is coming out from the bottom of the roll. Thank you for viewing this clinician training program. For further troubleshooting assistance or additional questions or information, please contact SurgiVet Clinical and Technical Support at 800-258-5361.